How do blood thinners prevent ischemic stroke? Imagine a tiny traffic jam inside your blood vessels that can cause serious problems. Blood thinners help prevent these jams by stopping blood clots from forming and blocking blood flow to the brain. An ischemic stroke happens when a blood clot blocks an artery supplying blood to the brain, causing brain tissue to be starved of oxygen and nutrients. This can lead to lasting damage or disability. Blood thinners work by interfering with the process that forms these clots, keeping blood flowing smoothly and reducing the chance of a blockage. There are two main types of blood thinners used to prevent strokes. The first is called anticoagulants. These medicines prevent the blood from forming clots by blocking specific clotting factors in the blood. Common anticoagulants include warfarin and newer drugs known as direct oral anticoagulants, which include dabigatran, rivaroxaban, and apixaban. They are especially helpful for people with irregular heartbeats, known as atrial fibrillation, because this condition can cause clots to form in the heart that then travel to the brain. When taken correctly, anticoagulants can lower stroke risk by about 60 to 65% in these patients. The second type is antiplatelet agents. These drugs prevent blood platelets from sticking together and forming clumps that can turn into clots. Aspirin and clopidogrel are common examples. They are often given to people who have already had a stroke or a transient ischemic attack, which is a temporary blockage. These medications can reduce the chance of having another stroke or serious blood vessel problems by roughly 20%. The way they work is different from anticoagulants. They stop platelets from clumping early in the clotting process. Both types of blood thinners target different parts of the clot formation process. Anticoagulants slow down the clotting cascade, which is a series of steps that lead to fibrin clot formation. Antiplatelet drugs, on the other hand, prevent platelets from sticking together, which is an initial step in forming a clot. To be effective, these medications need to be taken exactly as prescribed. For example, warfarin requires regular blood tests to monitor how well it is working and to keep the blood at the right thickness. Newer anticoagulants are easier to manage because they need less frequent testing but still requiring consistent use. Missing doses or taking too little medication can lead to clot formation and increase the risk of stroke despite treatment. Using blood thinners is often part of a broader plan to prevent strokes. This includes controlling blood pressure, managing cholesterol levels, and making healthy lifestyle choices like eating well and exercising regularly. They are especially important for people with conditions like atrial fibrillation, previous strokes, or other risk factors that make clot formation more likely. While blood thinners are very effective at reducing stroke risk, they do have potential side effects. The most significant is an increased chance of bleeding. That's why healthcare providers carefully monitor patients on these medications. Patients should watch for signs of unusual bleeding, such as nosebleeds, blood in the urine or stool, or excessive bruising, and report these symptoms immediately. Regular checkups and communication with healthcare providers help ensure the medication is working safely. In summary, blood thinners prevent ischemic strokes by reducing the formation of blood clots that can block arteries in the brain. They do this either by preventing clotting factors from working or by stopping platelets from sticking together. Their use is a vital part of preventing strokes in high-risk individuals, but they must be used carefully and under medical supervision to balance the benefits with the risk of bleeding. Always consult a healthcare professional to determine the best approach for your specific health needs and risks.